everybody. Welcome to this meeting of the Local Outbreak Engagement Board. This will be a virtual meeting with remote attendance by councillors and remote access of press and public, and will be held in accordance with the provisions of the local authorities and police and crime panels, coronavirus flexibility of local authority and police and crime panel meetings, England and Wales Regulations 2020. First of all, our first item on the agenda is declarations of interest. Do I have any declarations of interest, please? Paul Charnock?
No declaration of interest. I've just crossed over with my pointer move on, please.
No problem. Okay. Item 2 on our agenda is the minutes of the previous meeting. Do we have any issues or comments about the previous minutes, please?
Could I now intervene and say that I was actually recorded as being present, but it's not recorded on the actual minutes.
Okay, we'll change that. Thank you. Any other items to do with the minutes, please? No, in that case, we will adopt the minutes of the previous meeting. Our item 3 on the agenda is the Local Outbreak and Evacuation Plan monthly verbal update. We have apologies from Paul Masters, who is on leave this week. So Aisling Khan is kindly standing in for him. So good morning, Aisling. Over to you. Thank you.
Good morning. Thank you, Chairman, and thank you for inviting me. So obviously, since we last spoke, the government's announced its roadmap for a kind of brighter summer. Obviously, there's quite a few ifs in there. And so I think the key message that I'm sure Whitney will want to promote is that individuals, businesses and organisations need to play their part in making sure some of those ifs become a reality. Some of the management structures supporting the management of the pandemic are standing down to less frequent meetings, and that reflects the fact that nationally the risk level has dropped from a 5 to a 4. Locally, we continue with our local incident response team. We've still got symptomatic and asymptomatic testing processes in place in line with government guidance. The academy is in good shape for opening next Monday, and I know that the return to face-to-face teaching for families and children is going to be really positive, and schools got really good safety measures in place in line with governance. And the vaccine rollout nationally and locally is going really well, and I'd like to say thank you to our partners in health for making that happen and working in conjunction with adult social care to identify those audiences that are harder to reach, such as unpaid carers. The evacuation plan is agreed in principle, so that, again, can give reassurance to businesses. I think that's it for me.
Okay, thank you very much, Aisling. Are there any questions for Aisling, please? Councillor Quartek, please.
Just a quick comment, if I may, about communicating. I've been asked by a couple of businesses if the evacuation plan arrangements were going to continue, and they were very, very pleased to hear that they were. So if we could just up the messaging a bit, I think, there are obviously some businesses that haven't picked up on the fact that we have agreed to continue with that arrangement. That would be good. And I don't know whether it's appropriate to mention now or perhaps at another stage. There is some disquiet and indeed a little bit of misunderstanding about the arrangements for self-catering accommodation around April the 12th, where businesses cannot let self-catering accommodation with a communal entrance. And I just wonder who is best tasked to actually perhaps emphasise this arrangement, which does seem in some ways difficult to understand, but is indeed the law between April the 12th and May the 17th, as colleagues will be aware. Thank you very much.
I'm happy to answer that, Chairman. The great point on communications, that's noted. I am aware that Island Partnership is in contact with other trade bodies across the country to have a look at that and have conversations with government about shared kind of porches and corridors and so on. And that debate.
Yeah, I think we are waiting. I understand that there was an important meeting last Friday where it was put to ministers, and I think we are waiting for their decision on this, whether they stick with the original guidance, which says that you cannot have shared entrances, or whether or not they decide to change that guidance in any way. But at the moment, I understand it. It is still the original guidance, but it's not possible to have shared entrances. But obviously, I take your point, Councillor Grottick, and as and when we hear any further from government, we make sure the necessary communications are put out as soon as possible. Thank you. Any more questions, please? No? Well, thank you. I'd like to hand over then, please, to Dr. Whitney Curry. Welcome, Whitney, for your update, please. Thank you.
Thank you, Chairman. Good news, these days. We're feeling very positive. We are at 28.9 cases per 100,000 for Cornwall and the Isles of Scilly. So to put that into perspective, it would have been early October when we were back in the 20s per 100,000. So that's really, really good. Excellent work over this period of lockdown across the board. And I'm quite pleased with that. But it always comes with a warning from me, because I'm boring old public health, that we've got this roadmap, and it means opening up and movement of people in many different ways, in many different stages. But of course, we know now from experience in previous lockdowns and opening up, that we will see bumps in cases at every stage of that opening up. How much is really up to the communities in terms of the behaviour and adherence to the prevention measures. So I think probably one of my main messages today is we will probably see more symptoms and more tests being requested on Scilly as we open up throughout the stages of the roadmap. That's to be expected. We need to keep pushing those prevention measures and keep telling people, if you've got symptoms, you need to get tested. And those who are participating in the asymptomatic testing, keep doing it and keep doing it regularly. I'm glad you brought up the evacuation plan. We are still exercising our outbreak plans, and one of the exercises we'll be undertaking next week is, again, exercising our evacuation plan, so that we know we've got all the pieces in place, because things tend to change over time, and want to make sure that we've got a really tight process should we need to use it. So those plans are still being exercised. And finally, the other thing I wanted to really emphasize is the vaccination program across the board has been fantastic, and the majority of our very vulnerable residents have been jabbed. And I get lots of questions from people saying, okay, then why can't we just let COVID run its course now? All of the people who are vulnerable have been jabbed. Let's just get on with life. The problem with doing that is that when you allow a virus to just run through a population, there's more and more opportunities for it to mutate. And you'll see lots in the media at the moment about variants popping up here and there. And we know that viruses do that. When they have more opportunities to run amok, they mutate. And the problem with those mutations is more potential that our vaccines might not be as effective. So we still really, really need to work hard to suppress this virus so that it has less opportunity to mutate. And our vaccines will continue to be really, really effective. Loads of good news in terms of the studies coming out saying how effective these vaccines are, well above 80% for the Oxford, for example, in our over 80s cohorts. So it's really, really good, but we've still got to continue to suppress this virus so that we don't run the risk of more variants. Other thing, as schools opening, there's more opportunity for home testing for families of students, which is a really positive step forward. I'm sure Tanya will give an update around testing in general, but it's a really good thing that we're having some home testing going on, and we continue to push to have widespread home testing. So I know that's one thing many people have asked me. But otherwise, that's all of my updates. I'm happy to take any questions that anyone might have.
Thank you very much, Corey, for your public health update. Are there any questions for Whitney, please? Stephen Taylor.
I was just wondering, Whitney, whether the opening of the schools will require any specific communications to deal with the issues that arise from that.
I'm aware that there are some specific communications, and those are being discussed at the moment, possibly around the... Really, we've been through the opening previously, haven't we? Lots of stuff has already been worked out, and parents and families are aware. It's possibly this additional component of the home testing bits that we're trying to make sure we've got really, really strong messaging. I think they all know they get them, but it's about how they get them, how they return them, and we're making sure we get those processes in place quickly and get that messaging out.
So does the board need to make any decisions on that or give any advice on comms to it?
I would probably defer to Tom in terms of those comms and the school. The school haven't requested additional support with that, but I'm aware that our testing lead with the council is working with them quite closely.
Thank you.
Yeah, we'll come on to Tom's communications update shortly, Stephen, so we can cover that then. Yeah, thank you. I would just like to thank you, Whitney, from the chair for your input. Thank you, and to reiterate your message that we must all still consider hands, face, space, following the guidance, and not relax in any way at the moment. As much as we all want to move on, we've got to stick to it, stick to our guns, and stay there until the end, and then we can hopefully enjoy life a little bit more. So thank you, Whitney, for that. Before I move on to comms, Tanya, did you want to come in at all on anything? I'm sorry, I meant to ask you following Aisling's report. Would you like to come in at this stage, please?
Morning, Chair. Morning, everybody. I can just provide a quick update on testing to you all. I think Aisling and Whitney have covered the key points already. PCR tests continue for symptomatic and pre-procedure patients, so they're operating as usual with the support of the local testing team, the steamship company and the Cornwall blood banks. So we're obviously incredibly grateful to them for their ongoing support. Our testing lead, Abby, is finalising the testing procedures for rolling out testing in the town hall, hopefully. We're hoping that will be in place from next week. We're just waiting for the final protocol to be signed off by Public Health in Cornwall. And as Whitney mentioned, the lateral flow tests, the new provision through the government is a fantastic opportunity where people can apply online to access them. And we're continuing to work with the school, the healthcare sector and the airport in rolling out regular lateral flow testing. So it's a positive outlook.
Thank you very much, Tanya. Are there any questions for Tanya, please, on testing or anything else? No, well, in that case, I'd like to move on to item 5 on our agenda, please, which is the communications verbal update from our officer, Tom Walton. Thank you, Tom.
Thank you, Chairman. So the primary update at the moment is the need to communicate the government's roadmap to ease lockdown restrictions in England. So this is obviously a case of balancing the optimism of the progress that's been made, whilst reminding the public that we're still, in fact, in lockdown. It might not feel like it sometimes, but we are still in lockdown, and the freedoms people are looking forward to, they're not yet available. So it's really important, as Whitney pointed out, that we just stick to the plan for now and then wait for that roadmap to play out. It's different from previous government announcements, as each date in it is indicative only, because they're all dependent on the 4 tests being met. So that's why it's really important to stick to the rules at any given time. We are continuing to provide the chairman's updates online and in print, although these have moved to fortnightly because whilst the government are making more announcements, the the local level needs to communicate on various issues has actually reduced as the pandemic has eased. So we'll review that, and we can go back to weekly if we feel it's necessary, particularly when the season starts to open and there's more to communicate and a greater need to sort of digest that information. But we'll keep that in review. Rapid, or what's called lateral flow testing, is something we're working on from a communications perspective at the moment. The government's keen to promote the availability of this nationally, but obviously we need to have local solutions in place, and we'll be looking to get some communications on that out shortly. There are obviously some people accessing this already on the islands, and they'll be aware of it, but other people might be wondering how they access it or if they're eligible for it. We'll be releasing more information on that shortly. The school issue that was raised earlier in this call, so far the school's been really effective in allowing children of critical workers to be able to learn on site. So they've got a lot of experience in having people on the site and safety precautions in place to stop any spread of the virus. So the confidence will be really high from the school, and I think we're confident as a council in their ability to do that. And school communications actually has been part of that. They've been really excellent in targeting appropriately at parents and pupils the various messages they need to get across. So we don't have any undue concerns over that, and we're on hand to support them as and when they need it. Communicating the rapid testing can be tricky, but that's tricky for everyone at the moment because it's a new service. It's not like a vaccine where you just turn up, you get it once, then you get your booster. It can be a case of doing it over a period of time. So it's not something people are sort of inherently used to getting, and the communications around that, we're all learning about that. So we're here to support the school, and we'll be looking to them to support us as well, because we're, they'll have a lot of lessons from having tested their own staff on site, etc., that we can learn from. But that's, in terms of the communications update, that's it for now. We're really waiting on the next stage of the roadmap to roll out.
Okay, Tom, thank you very much indeed for that update. Are there any questions for Tom, please? Yes, Councillor Williams.
Yeah, thank you. I'm just thinking about mid-April return of tourists to Scilly, who obviously won't be so familiar with some of the stuff we've just been talking about. I'm wondering if there are any lessons that we could learn from last summer when we were in a similar position in terms of reminding people about the social distancing, the mask wearing, how to get tests if they've got concerns, and just how to reaffirm the message that Scilly is no different to anywhere else in the country. I know there was a small minority last year who felt they were coming on holiday to get away from COVID, which obviously isn't the attitude we want to promote. So it's how we can make sure that messages come and have a holiday, but be respectful and don't forget the things which are going on at the same time around keeping Scilly safe.
Thank you very much, Joel. Wise words. Would you like to comment on that, Tom?
No, just I completely agree, Chairman. And it's easy to forget, actually, the work that went into the season last year, and we need to not forget that and make sure that we are engaging with the steamship and just making sure they've got everything they need from us to have the signage, the TV screens updated, etc., so that we're reminding people at the important point when they're about to take their journey to Scilly, and also on the quay as well, those points where you get crowding, etc. It's important that we engage properly with the partners ahead of the season. So, like I say, I have no doubts that we'll do it, but it is important for us all to remind one another of these things, because it's easy to forget with the development of the pandemic. So we'll certainly look into that.
Well, if we could take it forward as an action, please, Tom. I think that's the thing. We've got a month, just over a month, to get our house in order. Well, 6 weeks, but before the first self-catering guests due to arrive. So if we take it as an action to make sure that we're ready with that message, at least a couple of weeks prior, in a month's time, that would be really helpful. Thank you. Any other questions, please, for Tom? No. Well, in that case, we'll move on to Councillor Grottick. Thank you. You're on mute, Councillor Grottick.
Apologies. I was just going to hope that that Tom could liaise, as I'm sure he was planning anyway, with our police colleagues and anyone else who might have specific areas that they could offer expertise in before we welcome new visitors again. Thank you.
Thank you.
Yes,
Okay.
absolutely. We're in regular communication with the police and the steamship. So just to put everyone in the picture, we have a regular local incident response team meeting. So issues like this are raised on that. It's not something that we'd easily get forgotten, if you see what I mean. So we're in constant conversation, and they're raising any key concerns. For example, it'll be useful to know what the police have in place in terms of sort of on-site support at either end, either airport or either port. So they're the kinds of things we'll be discussing on the response team.
Yes, thank you.
Okay, thank you very much. Okay, so if there aren't any further questions at this stage, we'll move on to item 6 on our agenda, the last item, which is just if there are any other issues that any of the board would like to bring to our attention, please. Is there anything from anybody? No? Well, in that case, thank you very much indeed for your attendance today. And with that, we will close the meeting. Would you like to come in? Sorry, Carly, were you...
Yeah, thank you, Mr. Chairman. I just wanted to reiterate our ongoing message, really, and just echo what everybody else has said. I think that we're all really eager to avoid any kind of complacency on the island from locals, from workers, from tourists in the future, but we continue to be proactive in our patrols. We're regularly up at the airport every day. We're regularly out patrolling in the evenings, just really trying to deter people from breaching and preventing it as much as possible. But we do continue to see really good compliancy on the island.
Okay, well, thank you very much indeed for that, Carly. With that message, we will close the meeting. Thank you very much indeed for all your attendance. Thank you.
Thank you, Chairman.